I know?
Yes.
Yes, I'm aware of that about OCD.
Yes, a little bit.
OCD for me is the Obsessive Compulsive Disorder, which makes the patients obsessive to do certain things that they do.
I think OCD is Obsessive Compulsive Disorder.
I think obsessive compulsion disorder.
In my opinion, I think OCD is a repetitive action about someone doing action about obsessive action and compulsive action that is affecting their daily life.
Obsessions, compulsions, disease.
Because the patient is obsessive towards their negativeness, so they need to settle down for a long time. So it makes me uncomfortable with them sometimes.
Maybe people who suffer OCD, they tend to do things multiple times. They're doing things repeatedly. Maybe they are net freaks. Maybe they are so particular about their politeness or something like that.
I think someone have obsessed to do something with arrangement, like they must arrange all hanging with color.
In my personal experience, I have relatives who are suffering OCDs. For example, I have a grandfather. He used to clean up himself after doing his chores and after returning from outside for a long time.
To me, people who suffer from OCD might doing repetitive activity and they seem to be perfectionists in every activity they do.
OCD stands for Obsessive Compulsive Disorder. In scientific terms, OCD is abnormality in the serotonin pathway and dysfunctional circuit in the orbitostriatal area and dorsolateral cortex. In the layman terms, OCD characterized as a mental disorder in which people experience with thoughts, feelings, ideas, sensation, and behavior that trigger intensely distressing feeling and lead to compulsive act, which is repetitive activities to get rid of the feeling of anxiety. However, the feeling of relief is just temporary. The difference between obsession and compulsion is obsession are recurrent and intrusive thoughts that are typically unwanted thoughts that are tough to get rid of your brain. These unwanted thoughts, like my house is unsafe, cause anxiety. Compulsion, which are actions that might be performed to try and reduce anxiety associated with obsession. A very common compulsion is cleaning, which often stems from the obsession with germs or contamination. Another common compulsion is checking usual because they have obsession that something unsafe that they check to make sure that something is definitely safe by unlocking or relocking it sometimes several times. Sometimes patients might feel compelled to order or arrange things because they are out of order, causes anxiety and discomfort. OCD cycle consists of 4 things, that is, obsessive thoughts, anxiety, compulsion behavior, and also temporary relief. There are 5 types of OCD. First is contamination obsession with cleaning compulsion. They usually excessively wash their hands to avoid contamination. Second is obsession without visible compulsion. Those who are facing the counters and arranger OCD are obsessed with orders and symmetry about certain numbers, colors, and arrangement. Third is hoarding. This category of OCD made people to fear that something would happen if they throw things away. Next, symmetry obsession with ordering compulsion. These kind of people feel they need to do everything perfectly or else they will be punished. Last but not least, harm obsession with checking compulsion. They would repeatedly check things that is harmful for them, such as whether they lock the key door or they switch off the gas stove. Causes of OCD. There are few factors, which is neurological causes using brain imaging technique. We show specific area of the brain have some part of the brain are different in people with with OCD when compared to those without OCD, but it is not known exactly how these differences relate to development of OCD. Imbalance in the brain chemical, serotonin and glutamate, may place in a part of OCD. Second is genetic causes. OCD runs in families and can be considered a family disorder. The disease may span generations, with close relatives or people with OCD significantly more likely to develop OCD themselves. Third, environmental causes. Environmental stressor may be trigger for OCD in people with tendency towards developing the condition, such as traumatic brain injury or so-called TBI in adolescents and children has also been associated with increased risk of onset of obsessive compulsion. Next, behavioral causes. The behavioral theories suggest that people with OCD associate certain object or situation with fear during the beginnings of stress period. Last but not least, cognitive causes. The cognitive theory focuses on how people with OCD misinterpret their thoughts at certain times with overstressed feelings. OCD treatment. First of all is psychotherapy. Psychotherapy is a behavior therapy that is effective, specifically a technique called exposure and response therapy, where patients are first exposed to anxiety and compulsion-provoking situations to help them face their fear and cope with it. Second of all is medication. A selective serotonin reuptake inhibitor, or SSRI, has been shown to be an effective drug treatment for OCD patients, especially in anxiety disorder. The following are a sample of SSRI drug that could be consumed. Last but not least, community support and recovery program is encouraged to help people who have OCD which give them support. OCD support in group setting can be very helpful because as an OCD sufferer, you cannot be alone and isolated. It is important to build and maintain a strong support network to build confidence. An OCD support group can serve an important reminder that you are not alone in this struggle.
Hi, dear OCD sufferers. To all the OCD sufferers, to OCD sufferer, to OCD sufferer, to all OCD sufferers. It's okay for you to have OCD. We will always be here when you are in need.
Support groups can always be a great helpful medium for you guys to share your experience, connect with people, and also you can always share your problems with the people, gather with people.
Don't worry, we understand what are you facing. You are not alone.
Be yourself and don't shy to tell what your problem is.
Believe yourself, you are not crazy and you are not alone. OCD is the disorder of dogs. Stop all the dogs and we will stop OCD.
You, whenever you are, everything is going to be okay.
Then we always understand you very well.
So be strong and you'll be okay. Because we're here to help you.
Don't even get discouraged.